Hi, in this video, I'm going to be talking about some simple approaches to exercise during breast cancer and its treatment. Why exercise during breast cancer? Well, exercise is one of the most important things in managing stress, your overall health, and sleep in particular, as well as your mood. So although we might find ourselves resisting movement, the benefits actually really pay off. And even after a bad night's sleep, it appears that getting some movement in, some exercise, is more beneficial for your energy level and your sleep the following night than taking a nap. I know it can be so tempting. I'm a big napper myself. I love a great nap on a Saturday afternoon, but it actually, in terms of getting more energy in your energy bank, getting outside in particular with some natural light and moving yourself in your body can be really helpful, even if it's, I'm serious, 5 to 7 minutes. So as tempting as it is to just snuggle under the covers or laze about, if you want to go out for a slow, relaxed walk, you're going to reap the benefits. So exercise helps our sleep, energy, mood. It can help distract us from things that maybe aren't as healthy for us, like fog eating. Fog eating is when we eat without really enjoying our food. Sometimes movement can take the place of that. So I can't stress enough the importance of some movement during breast cancer treatment. This is after surgery, during chemotherapy, if you're on endocrine therapy, radiation therapy. Exercise is the one thing we know that improves fatigue over almost everything else. When I'm talking about exercise, what kinds of things am I talking about? Well, what you feel like doing is going to vary. Some days you're going to have more energy than other days. And while I want to encourage you to do something that maybe doesn't seem as appealing at the beginning, I also want to urge you to listen to your body. So if you are exhausted, just really, really exhausted, going to the mailbox counts as movement that day. And other days, it may be more like a 15, 20-minute walk. If you are an athlete, you know what I'm talking about. Not getting movement is actually more detrimental than making yourself move on days you don't feel like it. And really, this is the case even for those of us who aren't athletes. So your energy is going to vary. There's really no treatment for which you can't get outside and move. So there's really nothing where your physician or medical team is going to say you shouldn't exercise during this type of treatment. What kinds of things count? Well, I use the word movement instead of exercise because some people hear exercise and they're just like, that's not for me. So movement just means moving your body. This might be something as simple as stretching. It might be dancing. As I've mentioned, going on a walk can be great. You might find that you want to do some low impact aerobics, especially as your energy gets better as you approach the next cycle of chemotherapy. Actually feeling the strength of your own body can be incredibly affirming because we tend to see ourselves as sick. Seeing yourself as well and realizing that you're going through this now, but the goal is to help you feel well and healthy and vital, and reminding yourself that your body really does work. Ask your medical team if you can lift weights. Turns out that resistance training, like lifting with weights, actually decreases the risk of lymphedema. We used to tell people, probably up to 10, 15 years ago, to baby the arm on the side where they had lymph nodes removed. So people wouldn't move that arm as much. And it turns out that's the exact opposite of what we know is to be helpful. If you've never lifted weights before, you're going to want to start with an exercise band. You might want to start with a wall push-up or holding a can of soup. You just want to start with some movement and then gradually work your way up. You can check with your medical team to make sure there aren't any restrictions for you. Swimming, even going to a public swimming pool, is not unsafe once your surgical wound has healed. You are, for the most part, not immune compromised except for the middle of your chemo cycles when your counts are lower. But most people who are on chemotherapy that lowers their white cell counts are also receiving shots to boost the white cell count and keep it up. Check with your medical team to find if there are periods in your treatment where you're going to want to avoid being around crowds, including a swimming pool. Bicycling is great. You get your heart rate up, you feel the air, wear a helmet, but you can feel the breeze on your face, if not in your hair. There are lots of other things you can do, and there's really no restriction on what you can do. So if there's something you've done in the past, whether it be hula hooping or rock climbing at a rock climbing wall, you can do these things. I want to encourage you to feel as alive as possible, and moving in your body is one way to do that. I hope this has been helpful. If it has, click like and subscribe. Share your experiences with us and the rest of the Yerbba community in the comments below. You can go to yerbba.com to get your personalized report and hear about treatments that might be offered to you in treatment of your breast cancer or the person that you love who you're watching this for.